QT interval and HCQ. The QT interval in an ECG is from the beginning of the QRS complex, representing ventricular depolarization, to the end of the T wave resulting from ventricular repolarization. What do you mean by QT? Is the time from beginning of the QRS complex to the end of the T wave resulting from ventricular repolarization. In general, the normal QT interval is below 400 milliseconds. I repeat and remember, below 400 milliseconds, 400 to 440. Women can have a longer QT interval than men. Due to the effects of heart rate, the corrected QT interval, called QTC, is frequently used. There are risk factors associated with QTC prolongation. They have been developed into a risk score tool that takes age, sex, diuretic use, potassium level, baseline QTC, acute myocardial infarction, use of QTC prolonging drugs, sepsis, and heart failure into account. Those considering hydroxychloroquine for COVID-19 patients, please consider the following. Number 1, an ECG with QTC evaluation. Avoidance of non-essential QT prolonging medication. Identifying and correcting electrolyte imbalance, and discontinuing non-essential QTC prolonging medications. In addition, consider comorbidities that may increase therapeutic levels, such as acute kidney injury or liver disease. Factors to be considered while hydroxychloroquine is being thought about in giving a COVID-19 patient either for treatment or prophylaxis. Beware and consider all these factors. Due to the effect of heart rate, the term corrected QT interval, QTC, is frequently used. The QTC is considered prolonged if greater than 450 milliseconds in males and 470 milliseconds in females. I repeat, the corrected QTC interval should be less than 450 milliseconds. QT interval prolongation is the result of abnormal repolarization of the ventricular myocardium, resulting in lengthening of the QT interval on an ECG. In females, the normal corrected QT interval is 470 milliseconds, and males slightly lower at 450 milliseconds. It can be the result of congenital genetic mutations in cardiac myocyte ion channels, acquired from electrolyte derangements, that is hypocalcemia, hypokalemia, and hypomagnesemia, or from use of numerous medications. Common classes of medications include antibiotics, antiarrhythmics, antidepressants, and antipsychotics. Clinical manifestation of prolonged QT interval include syncope and sudden cardiac death from a fatal cardiac arrhythmia known as Torsades de Pointes. Torsades de Pointes. TDP is a form of polymorphic ventricular tachycardia with a heart rate greater than 100 beats per minute, with characteristic twisting around the isoelectric baseline around every 15 to 20 beats. Now let us have a look at the drugs that are known to cause QT interval prolongation. Antibiotics, quinolones, levofloxacin and moxifloxacin. Beware, quinolones, levofloxacin and moxifloxacin. Macrolides, erythromycin and clarithromycin. antiarrhythmic drugs class 1A quinidine, procainamide, class 3 dofetilide, antidepressants, amitriptyline, desipramine, imipramine, fluoxetine, antipsychotics, neuroleptics, haloperidol, atypical antipsychotics, ziprasidone, risperidone, citalopram. Beware of all these drugs that can cause QT interval prolongation. Of the documented medications known to cause QT interval prolongation, hydroxychloroquine is extremely rare in the literature. HCQ is an antimalarial drug that has been the cornerstone for treatment of SLE. HCQ has a long half-life ranging from 32 to 50 days with a modest side effect profile with most common reactions associated with GIT and ocular toxicity. The drug is commonly utilized in the treatment of SLE for patients with end-stage renal disease and now COVID treatment. However, the exact dosing and toxicity are not well established and requires further study. HCQ is now thought to be considered in the treatment of COVID. The proposed mechanism by which HCQ causes QT interval prolongation is not well understood. However, recently it has been demonstrated that the sinoatrial node myocytes HCQ has an inhibitory effect on sinoatrial node myocytes, causing hyperpolarization activated current ion channels known as funny current channels, along with delayed rectifier potassium currents and L type calcium ion currents. Repeat again, what is the action of HCQ has been demonstrated in the pig ion sinoatrial node myocytes, wherein it is found to exhibit inhibitory effects on the hyperpolarization activated current channel called funny current channels, along with delayed rectifier currents and L type calcium ion currents. A suppression of the sinoatrial node myocytes. These inhibitory effects on the pacemaker cells were shown to cause delayed rates in depolarization, leading to decreased heart rates in the cell line studied. These findings may correlate with the proposed mechanism by which refractory action potential in cardiac myocytes may lead to prolongation of QT interval due to delayed depolarization and repolarization from abnormal ion currents. Now, patients who are given hydroxychloroquine are also now put on azithromycin and realize that azithromycin also carries the same heart risk of prolonging QT intervals. So, beware of knowing all these fundamental factors and the cofactors that can contribute to QT interval prolongation, because if you do not, there is the possibility that patients can have sudden death. Beware.